The purpose of this speech is to inform my audience that opium epidemic has become a crisis to our country because it is the leading cause of death of America, and the misuse prescription opiate is a total economic burden to the U.S. I want my audience to be aware and understand the impact of opiate epidemic. My central idea is that addiction and misuse of opiate is a serious crisis that impacts our social and economic welfare. My ideal audience for this speech would be for the public to be aware of the social and economic impacts of opiate epidemic. This topic is very significant to my audience because reducing exposure to prescription opioids and knowing how to manage pain are a crucial part of the prevention. Increase in opiate misuse and related overdose death become a public health crisis with devastating consequences. The increase in injection drug use has also contributed to the spread of infectious disease, including HIV and hepatitis C. All this contribute to a national crisis to affect public health as well as social and economic welfare. In 2016, more than 64,000 Americans died from drug overdoses, including illicit drugs and prescription opioids, nearly double in a decade. Main point number one, and misuse of prescription drugs alone cost the nation $78.5 billion in healthcare, law enforcement, and productivity, and that is the main point number two. And overdose death involving predominantly illicit opioid, heroin, synthetic, non-methadone, opioid, or both have increased by more than 200%. Data has suggested contamination in heroin supply with illicitly manufactured fentanyl as the overwhelming driver of the recent increases in opioid-related overdose death. Main point number one, overdose death involving predominantly illicit opioid have increased by more than 200%, and healthcare providers were persuaded to treat pain as a serious medical issue, and roughly 21 to 29% of patients prescribed opioid for chronic pain misuse them, per the study done by ValKE, Anti-ML, Neil J.P. Vendonor in 2015. And there's also another study saying that there estimate 4 to 6% of people who misuse prescription drugs transition to heroin, and that is per a study of Cicero, T.J., Alex M.S., Ixchel in 2014. People who are addicted to painkiller are 40 times more likely to be addicted to heroin. People turn to cheaper, more potent opioid when they are no longer have access to painkiller. And main point number two, the epidemic is inflicting harm on American economy as well as responsible for large-scale human suffering. The largest cost to the workplace is lost earning and employment, which accounted for $25.6 billion. Not just to the employer and employees who are losing productivity, but also to our civil society are the major consequences to the economy, per Howard G. Birdbaum, September 14, 2017, quote in New Yorker from Howard Benbar Analysis Group. And the study estimated total cost to the economy of $55.7 billion. In conclusion, more than 64,000 Americans died from drug overdose in 2016, including illicit drugs and prescription opioid, nearly double in a decade, prescription drugs misuse alone cost the nation $78.5 billion in healthcare, law enforcement, and lost productivity. In summary, on my main points, overdose deaths involving pentamidine and illicit opioid have increased by more than 200%, and the epidemic is inflicting harm on our American economy as well as responsible for large-scale human suffering. In closing, we need to educate the public that misuse of and addiction to opioid is a serious crisis that impacts our social and economic welfare.